Few telemedicine programs have been as effective in improving access to medical care as the one at the University of Mississippi Medical Center. Headquartered in Jackson, the UMMC program provides emergency medical care remotely to rural locations and now offers more than 30 medical specialties to patients at more than 100 clinical sites. Much of the credit goes to the leadership of Dr. Kristi Henderson, who wears a number of hats: Chief Telehealth and Innovation Officer, faculty positions in both the School of Nursing and School of Medicine, and nurse practitioner. In a video conferencing interview, she told me the success is due to the program's multi-dimensional nature and the involvement of an increasing number of specialists.
So we have increased that, not only in the number of specialties, but the number of locations. And I refer to them as access points because it's a portal of entry into the healthcare system. So we have 35 medical specialties that we offer now, and we have 177 locations around the state. So it's an effort to really allow as many access points to quality health care as we can around the state through partnerships with the community.
The prison population in Mississippi represents an important part of the UMMC program.
Yeah, so that's probably one of the most impactful programs that we have for a lot of reasons, and ones that everyone, I think, appreciates, and the cost of having to transport inmates to get health care with security and all the other cumbersome pieces to that. So we started a few years ago providing infectious disease services to the prisons for HIV care only at 3 of our state prisons. And just this spring or early summer, the prison system selected a new vendor for health management of inmates. And we were selected as the subawardee to all telehealth services. So not only are we going to continue those infectious disease clinics that we were doing 2.5 days a week at 3 prisons, now we're going to all the county and state facilities, jails, work centers, everything, not only around infectious disease, but we're slating a rollout in a phased approach to bring in multiple other specialties so that ultimately it will become a virtual clinic, a multi-specialty clinic, and we can serve inmates for most of their health care. And then they only are leaving when they need a procedure or an admission or there's an emergency. And for a lot of reasons, that'll not only improve the quality there, but also the safety and security issues will be addressed.
Small hospitals in Mississippi and elsewhere in the U.S. are struggling. If they aren't being purchased by a larger enterprise, they're closing departments or their doors. Dr. Henderson believes telemedicine may be the solution.
Yeah, absolutely. What we're seeing is that when you bring telehealth services to a hospital or a clinic, you're bringing a new service line there. So with a new specialty or a new service, that drives new business. And with that, you have increased revenue, which is helping those small community facilities stay open. With our emergency medicine program, we continue to assess that. And what we're finding is by having that connection to us, we're able to admit more people to the local hospital. And so that's an increased revenue, but more importantly, it's a more convenient solution that's providing quality care to citizens of the state. So we've had an increase of admissions to the local hospital by 20% in those partnerships. On equipment, well, equipment is a piece of the service. So if I was going to go do a surgery for an appendectomy, I know the pieces of equipment I need to do that are critical for that. And so I see that as just a piece of the service delivery. And so my cost for the service incorporates the cost of managing and purchasing all of this equipment. But you've got to look at all the downstream impact of this. So there's one thing that has revenue that comes in that pays for the physician services, but having the cost of the equipment brought into that equation can only be really show their ROI if you're looking at downstream things of improvement in health and cost savings from the total cost of care for patients. Not to mention, you meant, like in your question earlier when you asked, how does this helping struggling community hospitals? Well, by me purchasing a piece of equipment and putting a new service line into a hospital, they're bringing new business into there that might not be directly attributed through a telemedicine reimbursement, but overall the entire business to the health system increases and improves because of the new service line through telehealth. So it's not black and white. There's a lot of calculations and a lot of analysis that needs to be done on the economic impact of what happens when you put a telemedicine clinic into a hospital or a community.
UMMC uses GlobalMed systems as the backbone of its telemedicine program.
So we use the GlobalMed telemedicine card that we have as our standard telemedicine card at all of our hospitals. So any hospital or clinic that needs a mobile solution that needs peripheral devices, and that's our standard setup in our hospitals and clinics. And so we utilize that for all of our services. The 35 specialties that I named, any of them that require audio, video, and peripheral devices, this is the go-to piece of equipment. And so we use it there. We also have a test unit, the mobile transportable exam station, which we originally got for disaster. It migrated to where we also have it as our solution should we have a Ebola response or any infectious disease type of situation where we're trying to minimize the traffic and exposure to people. So that is our mobile station that we deploy should we have any of those situations occur. And so we continue to work with GlobalMed to provide the technology solutions that we need. And what we really like is the quality of the images and the storage capabilities of transferring that through your capture cloud. And the encounter workflow as well. So those that make it user-friendly and the quality is top-notch.
To improve workflow, UMMC has adopted GlobalMed's Encounter software application platform.
Yeah, so the workflow is very intuitive and easy to use. And that's important when you're having multiple different physicians and providers that may do this around their traditional in-person clinic that will be a different workflow on a different electronic medical record. So it needs to be intuitive so that they can sit down and use it very easily. And that's what we found to be true with this. So we've been very pleased with it.
Dr. Henderson points out that grants can help start a program, but a program that depends on grants for its operations will not be sustainable. For GlobalMed, I'm Roger Downey.